about to start. We're about to start.
Today's Pet Podcast. I am your host, Dr. Roberta Westbrook, and I'm here at the Houston SPCA, the campus for all animals. And we have an exciting show for you today because we are going to talk about all things related to skin. I love skin conditions. I love to see them. I love to try to diagnose them. I love to try to get them better. Skin is just really interesting to me. And so I have a really interesting skin case today. And I also want to introduce you guys to a wonderful dog that we have available for adoption today. And his name is Falcor. Is about a 3-year-old male neutered Great Pyrenees who actually came to us from our cruelty and investigations department because Falcor and his housemate were unfortunately tied in the backyard and they were not being taken care of. They were on short tethers and didn't have proper food, water, or shelter. So Falcor is with us and he is available for adoption. He knows how to sit, how to shake, and he's very mellow, very, very good dog, Falcor is. So come on down to our adoption center. There's no appointment necessary. You can bring your family and friends and see all the dogs and cats and puppies and kittens that we have available for adoption. So I will get started. If you have any questions about your pet's skin, please feel free to submit those questions. And I will start talking to you about some very, very common questions about skin that we have here. The patient that I have with me today is Wrinkles. Wrinkles is smelling the treats on my hand that I just had, and Wrinkles wanting to eat my little fingers here. Wrinkles is a puppy that we have here under veterinary care. You can see on Wrinkles' face that it looks a little bit abnormal here. So Wrinkles looks slightly abnormal. You can see that he's got a little bit of hair loss around both eyes. And you can see that on the bridge of his nose and his muzzle, that hair loss is increased there. And the skin around there also looks really crusty and scabby. But as you look around, Wrinkles' body, he doesn't have any more lesions, but it's pretty focused on the face there. And we have diagnosed Wrinkles with a condition called Juvenile Cellulitis. Sometimes people also call it puppy strangles. So what is juvenile cellulitis? Well, juvenile, one, means that it happens in young animals, young puppies, specifically. So usually puppies that are less than 6 months old. And then cellulitis. Cellulitis means inflammation, and inflammation of cells, cellulitis. In this case, it's inflammation of skin cells. So what we're seeing here is a lot of inflammation, and inflammation can lead to hair loss, and it can lead to secondary skin infection, and it can lead to kind of these crusty, scabby lesions that we see here on Wrinkles' nose. Now, you might think that the cause of juvenile cellulitis is something bacterial or fungal, and as veterinarians, we like to make sure that it's not that. But generally, juvenile cellulitis is immune mediated. What that means is Wrinkles' immune system here is actually attacking his own skin, and it's causing a lot of inflammation. And so one of the treatments for this condition is actually steroids. We oftentimes will give them antibiotics to treat any secondary conditions, bacterial conditions, but the cause of this is generally an immune-mediated condition where his body is attacking his own skin cells. So, it does have a good long-term prognosis after the treatment, and they've recovered. They tend to be fully recovered. And so we wish the best. We have no reason to believe that Wrinkles is going to go on to live a long, healthy life. But this is juvenile cellulitis. Now, I mentioned earlier that it can be called puppy strangles. The reason it can be called puppy strangles is because in some cases, their lymph nodes right here under the chin become very, very swollen and inflamed. And sometimes it can appear that it is causing them to become strangled or even have difficulty breathing because of the large lymph nodes and the pressure on the throat. But we have caught Wrinkles' case early, and so he does not have a severe case of juvenile cellulitis. So that's Wrinkles. So we hope to see him looking much better here real soon. Any questions?
Yeah, so somebody on Instagram, LCB, asked, what do I do if my pet is scratching but I do not see any fleas?
Oh, yes. What do you do if your pet's scratching but you don't see any fleas? So there are lots of reasons for scratching. You might think that this is kind of a silly question, but knowing where the scratching occurs is really important. For example, if your pet is scratching or wanting to bite at or chew at the base of their tail or the back part of their thighs, for example, those are areas where fleas love to reside. So even though you don't see the fleas, the location of the scratching and the itching can actually indicate that it could be fleas. And fleas are so fast. I mean, they crawl through the fur and they get away from you. So sometimes it might only be 1 or 2 fleas and they're just evading your glance, but they could be there, particularly if that's location. However, scratching is sometimes around the neck. That might be just minor collar irritation. It could also be fleas. And so it just depends on the distribution. And I would say make sure that your pet is on a regular monthly flea prevention prescribed by your veterinarian. And if you're on a monthly flea prevention and you're still seeing the scratching, then I would say see your veterinarian and see if there's some other cause for the itching that you're noticing.
So Jeff asked that they have a Basset Hound Lab mix that seems to have the same type of crusty around like their neck. Would they need steroids as well?
Oh, this is a great question. So one thing I want to point out, because I love this part about skin, but also the most frustrating part about skin, and that is that inflammation in the skin can be caused by lots of different things, and they can look exactly the same. So the hair loss that you see around Wrinkles' eyes and the hair loss around the muzzle, that can look very similar to other skin conditions like Demodex, which is a mange, which is a mite. It can cause hair loss around the eyes too. Other immune-mediated conditions like pemphigus, it can also cause very similar lesions. Fungal infections can also cause very similar lesions. So juvenile cellulitis is only going to be in a young puppy, and we will have ruled out all the other causes. So again, if your dog has lesions that look similar to what you're seeing in Wrinkles, but you have an adult dog, we would take a really thorough history of when this started, how long, is it getting better, is it getting worse? But then also, we would make sure that it's not bacterial or fungal first, and then if it isn't, then we might go to some more tests to try to figure out why that is. But good question, because a lot of these conditions can look very similar at first.
So we have Pat who asks that their 6-year-old has hot spots. During the summer months, they've tried antihistamines. They have, raw diet, decent weight, inside dog. What else can they do? They feel like they're at a loss.
Yeah, for hot spots specifically. So
Yes.
if your dog's getting hot spot, this is a hard thing too. So thick coated breeds. I'm not. Did Pat say what kind of breed of dog?
What is it? Oh, it's a double coated Aussie.
Yeah, so sometimes thick coated breeds, the fur can sometimes trap moisture, and that can be a great environment for, bacteria to build up underneath the coat, particularly when it's humid, or maybe they've gone swimming, all the moisture there, and it's a dark environment. So it's prime real estate for bacteria to want to, proliferate and increase, causing that hot spot. It doesn't mean that you have to go and shave your dog at all, but it does mean sometimes that they're just going to be more prone to it. So I would say make sure that if they're going swimming or anything like that, that you keep them nice and dry. We might let wrinkles get. I don't want wrinkles for his bottom to fall off. You want to go play, Wrinkle? You can have all the treats you want. So when you're dealing with hot spots, sometimes hot spots can occur because animals are already predisposed to licking and chewing at their skin. So if there's an underlying allergic condition, so if your dog has been diagnosed with allergies, either environmental or food allergies, and so they're already licking or chewing at the skin for another reason, that can cause a local hot spot, because all a hot spot is focal skin infection. That's all it is. It just means that there's a focal area where bacteria have grown, and it's creating a moist, oozy environment that's really, really annoying to the dogs, but has a good long-term prognosis. So I would say see your veterinarian, make sure there's no underlying condition like allergies, keep your dog dry, maybe stay out of the heat in those hot summer months, keep them bathed and groomed, and those things might help prevent the hot spots.
Somebody else on Instagram asked, how do you treat allergic dermatitis?
Yeah, so that's what I was just talking about, so allergic dermatitis. If a dog has allergies, we as people tend to think of allergies as sneezing, runny eyes, and that sort of thing. That can happen, but when we're talking about allergies in dogs and cats, more often than not, those allergies manifest themselves as skin problems. That could be chronic itching, chronic skin infections, chronic ear infections. So I forgot the original question. How do you diagnose?
How do you treat it?
How do you treat it? So if your dog or cat has allergic dermatitis, it depends on the type. So if it's a food allergy, your veterinarian can do tests and help you determine that. And it might just be a matter of changing the diet. If it is something to the environment, oftentimes we're not able to cure those animals, but we are able to manage their allergic reaction. So it's not uncommon for dogs, particularly in the South, to have allergies to things outside, grasses, trees, molds, dust, sometimes dander from other pets. So the treatment can be a combination of things. We have drugs that can modulate the immune system so that the immune system doesn't overreact, causing all the inflammation and itching. Sometimes we have to use antibiotics. Sometimes we have to use steroid type anti-inflammatories to reduce the inflammation and help with the itching. But typically we don't love to keep animals on steroids for a long time unless they absolutely have to. We can use medicated baths. There are lots of ways that we can manage allergic dermatitis, but oftentimes it's not curable. It's just a matter of changing the environment, using some medication, and sometimes changing the diet. It's very, very common.
So is paw licking an example of that?
Yes, paw licking can be an example of allergic dermatitis. So again, what type of allergic dermatitis? Paw licking can be related to food allergies. You might think, well, what's going on with that? It's really just related to the inflammation in the skin. And so when animals lick their paws, sometimes that is a sign of food allergy, but it can also be a sign of environmental allergies. Your dog's walking in the grass or walking in the garden. If they have an allergy to grasses or trees or molds, it is very possible that after they've gone outside, that it sort of triggers their allergies and they start to lick their paws more. It would be great to go see your veterinarian, make sure we're ruling out food allergy, flea allergy, and then trying to determine whether or not this is an environmental allergy. Another thing that I want to point out to you is that typically an environmental allergy, something that is due to grasses, trees, mold, something in the environment, those tend to get worse in the spring and summer. So when everything's growing, the pollen is out, We tend to see flare-ups of those conditions in the summer. Sometimes it's year-round, but they tend to flare up and they tend to get a little bit better in the cooler months. Not all the time, but sometimes get better in the cooler months. Whereas food allergy tends to be year-round because they're eating that food all the time. So if an allergy to a particular food, they're going to be eating it year-round. You might see symptoms of skin problems year-round.
All right, so Miss Nora has a very itchy Chihuahua. They've tried cytopoint injections, Brevecto, but it still continues. Any other treatment that you can think of?
Gosh, this can be frustrating. So I would want to ask a couple of questions. One, is the itching so bad that your dog can't, for example, walk across the room without scratching? Can they not sleep at night without scratching? In those cases, yes, I would say maybe there is more either testing that needs to be done or maybe some medication that can be added or combined. That's very possible. If the itching is just periodic, because sometimes people think that your pets should not ever scratch, but they can. So the periodic scratching at the neck or scratching at the rear, that's fine. We do tend to worry if the scratching is so frequent that it's causing hair loss, or if it's so frequent that they can't sleep at night, or you can't sleep at night because they've got a collar on and they're like, and the tags are moving, then we think, okay, this is happening enough that we might need to get it treated. But you've done great things. Brevecto for fleas and ticks. That way we can prevent prevent flea allergy dermatitis. So hopefully it's not flea allergy dermatitis. And then you mentioned cytopoint injections. That's one of those immunomodulating drugs. Cytopoint actually provides like antibodies against certain inflammatory molecules in the body. And so it helps to block those inflammatory molecules and help the animal not be so itchy. But not every medication works for every dog. So there are certainly other anti-itch medications out there. There's some that come in pill form. And so talk to your veterinarian about maybe a different option, because there definitely are some other options for itching.
You mentioned food allergies a lot. So if we think that's the cause, should we just stop the dry food and then try bland chicken or brown rice?
Yeah.
Or what's the best way to eliminate that?
So a couple of important things about a food allergy. Sometimes we don't know what ingredient it is that your pet is allergic to. The most common thing that your pet might be allergic to is actually an animal protein in the food. So it could be that they're allergic to chicken or fish or lamb or beef or pork. And so what your veterinarian will likely have you do is switch to a food that has a very novel protein that your pet has not likely developed immunity against. Or there are some foods that have proteins in them that are modified in a way that the body can't recognize them. So what we have to do is eliminate all suspects for what your pet might be allergic to. So that's a very, very strict diet. It means no table scraps, no treats, sometimes no flavored medication. If the medication is beef or chicken flavored and your pet has a beef allergy and you give them medication that's beef flavored, well, it's going to throw off that food trial, for example. So your veterinarian is going to try to put them on a very strict, specific diet to eliminate all of the animal proteins. And then we have to do that for 3 months at least. 3 months. So don't expect to see changes in 1 or 2 weeks. It can take up to 3 months to really diagnose your pet with a food allergy. And then once they're diagnosed with a food allergy, hopefully the food that your veterinarian put you on is something that we can keep your pet on long term. And that will be the way that we treat it and diagnose it.
So if a dog has flaky, dry skin, can they just put lotion on it, or do they have to have
flaky, dry skin? So, one thing I would want to know again is see your veterinarian about why it's so flaky and dry, because we want to make sure that we're treating any underlying conditions. In general, you can get at your local pet stores, shampoos and conditioners that help to keep the skin, nice and moisturized. But I would not start there. I would start by, especially if you're seeing a change. So maybe your pet has not always had this dry, flaky skin and it's becoming that way. That's a change. I would see your veterinarian about it first, or if it's getting worse, because sometimes just putting lotion on it is not going to fix the underlying cause, and we want to do that. But they do exist. Some medicated and regular lotions exist. For example, things that are oatmeal based. So oatmeal-based shampoos and conditioners do tend to have like a calming effect for some dogs. It may not work if your dog is severely itchy. Then oatmeal baths may not be enough, but oatmeal is a very common ingredient in dog shampoos and conditioners that tends to help have a soothing effect on the skin and maybe help with some of the itching.
Somebody asked on Instagram that there's thinning hair on the dog's tail. So would that be is it common for it to be at a specific spot?
Yeah, so thinning on the tail. I would ask so many more questions. This is why when you go to the veterinarian, they're asking you a lot of questions. It's not because we're trying to annoy you. It matters so many things. So I would ask, if you have thinning on your pet's tail, is this an older dog that you've got? Does your dog chew at that area on the tail? Does the skin look normal on that area of the tail? Because as I mentioned earlier, the base of the tail and the back of the thighs is a very common location for flea allergy dermatitis. But it's also a common location for hair to fall out if they have thyroid disease like hypothyroidism. Sometimes dogs with hypothyroidism will gain weight, and then they'll also get what's called a rat tail. So the rat tail means that they'll start to lose fur along the tail, and sometimes the tail will be very, very thin, maybe only be there at the tip. Sometimes if your pet is overweight, that base of the tail will create like a fold in the tail, and they get bacterial and yeast infections there. So that could be a reason that the hair falls out. So there could be lots of causes for it. But again, I would start with your veterinarian. Another common cause for hair thinning is as your pet gets older. It's not uncommon as pets get older for them to have somewhat of a thinning coat, and the hair doesn't grow back as fast. So if you have an older animal and, for example, they get a haircut or they get shaved, sometimes the hair takes a little bit longer to come back, and it doesn't come back in the same color or in the same texture that the original coat was there.
And what is the reasoning why they would have like a crusty skin on their elbows?
Oh, yes. Very common. So if you've ever looked at your dog, not uncommon in any breed, but more common, I feel like, in larger breed dogs, where on the elbows, the skin looks very calloused and thickened and sometimes crusty. And that's exactly what it is. It's like a callus. So particularly when you have a large dog, and if they're on hard surfaces, but sometimes if they're not, when they lay down, they kind of hit their elbows on the ground repetitively over years and years. And so as they get older, the skin over the elbows becomes calloused. It just becomes thicker, more wrinkled, sometimes a little bit flaky there. It's not really uncommon at all and not usually a problem. Now, if they're starting to get kind of a swelling over the elbow, then certainly take them into the veterinarian, because there's a condition called a hygroma, like just a little fluid-filled like cyst over the elbow, just from repetitive hitting of the elbow on harder surfaces. So, but that callous skin there, you might notice it not only on the elbows, but in some animals, you might notice it on the hock, on the ankle, the side of the ankle, that bone. That area sometimes gets callous too. The skin, the fur falls out and the skin gets kind of tough. Usually not a problem for the pet, but if you're concerned at all, again, see your family veterinarian so that they can tell you for sure.
So when you guys get puppies like wrinkles that have skin conditions, do they go up for adoption automatically?
Oh, great question. So if we have a dog like Wrinkles that has a skin condition, we don't put them up for adoption right away, because we want them to be getting medical care from our veterinary staff. So we want our veterinary staff to treat them, and we want to make sure that when they get adopted, that the adopters have a complete idea about his condition, so that they know what to expect in the future, whether they're going to have to deal with it in the future. And so Wrinkles is under veterinary care right now, and he's not available for adoption. We want to make sure that we can get him all cleared up and healthy.
And how can somebody help the rescue pets that do have skin conditions?
So if you have a pet that maybe you've rescued off the street that has a skin condition, if you're willing to take them to a veterinarian, kind of get a first, exam of, of that pet, and make sure that there's nothing contagious, because we get lots of dogs that just need a lot of tender, loving care is what they need. And so if you are really interested in helping some of the dogs, particularly the ones that we have here, always consider opening your home as a foster. So look how cute. Consider opening your home as a foster family. We are always looking for people to open their homes temporarily to animals who are just under care for a short while, waiting to get healthy so that they can go up for adoption. We're always looking for that. So if you are interested in giving some of our pets a little TLC and a temporary home while we're waiting for them to get better, please consider doing that. Go to our website, HoustonSPCA.org, and look for ways to become a part of our family.
There's so many more skin questions that we'll probably need to do a part 2 next week. But I mark it out for this time.
Let's do part 2 next week of all the skin conditions. It's so common. We see a lot of these things. And so again, but I love them because they're so rewarding to get better. Most of the time, skin conditions are very rewarding and get better really soon. So we will see you next week. Thank you for joining us. It's always a pleasure to talk to you guys and give you a little bit of information and help with your pets. Please come on down to our adoption center this weekend and join us. But if you can't do that, visit our website and look at our pets available for adoption and look for ways that you can support us in all of our efforts to help save dogs and cats in the Houston area. Okay, we will see you next week. I'm your host, Dr. Roberta Westbrook. Enjoy your day.